All right, so we just went through that entirely long and robust examination. You might be thinking, oh, that's cool. I learned some things, but like that doesn't seem practical at all. And you know what? I agree with you. So what we're gonna walk through is the practical clinical exam for how we do it in primary care. Essentially, this is gonna cover what you need to know to make sure we're not missing things, but also in a practical way so it doesn't ruin all your time in clinic. And my goal with this is you can do this exam in just a few minutes. It's comprehensive, but quick. And so let's get started. First, for inspection, we have to look at the skin to make sure there's no lesions, no gross atrophy, or enormous scapular winging. That's the big thing. So start looking at them statically, right? Just kind of look, see how they're looking. And then once again, look from behind as they're moving through their range of motion. For palpation, the biggest deal is gonna be the AC joint. And so I typically go right to the AC joint. And if you wanna do the anterior of the shoulder or the lateral deltoid, that's fine as well. But they could really hone in on the AC joint. Then for range of motion, we're going to quickly assess range of motion through shoulder flexion, abduction, seated external rotation, and internal rotation by reaching behind the back and reaching towards the shoulder blades. After that, we're going to go on to strength testing. For strength testing, we're typically testing our rotator cuff strength. So we're doing resisted external rotation, the belly press, and the full or empty can, depending on how angular their shoulder is. And for neurovascular, we're going to check sensation, right? Looking for equal in all digits and then normal radial pulse and cap refill. And for the special test, once again, we go back to our buckets. Think about our buckets. AC joint. Are they tendon to palpation? Quickly do the cross arm adduction test, then resisted extension, and right into our scarf. Then for rotator cuff, we already did it. We already checked the strength, and so that's done there. Next, move on to impingement. Here we take them through Hawkins test, and then Neers, and then also you can do scarf test, which you already did in the AC joint testing. Next, moving on to labrum and biceps. And next for the biceps, we need to do a Speeds and a Jurgensen. And for labrum, typically I'll do O'Brien, so I don't have to move them down the table like I do for biceps load or anything like that. But if you have further concerns, then you may have to do additional tests like that bicep load or the crank. That's pretty much it. This literally takes no more than 2 minutes. And I'm gonna just demonstrate what it looks like to see that in a patient in real time right now. All right, so now I'm running through my practical shoulder exam. This is the exam you can use in clinic to make sure you're getting a comprehensive yet concise exam, and I'm gonna run through it in real time. All right, so first I'm just kind of looking here to make sure. Okay, and I'm pushing. Any pain at all when I'm pushing up here? No, that's okay. All right, next I want to check some range of motion. Can I have you bring your arms up for me overhead? I'm just gonna look at your shoulder blades. Good. Slowly down. And I'm gonna have you bring them out to the side for me. Good. Great. Next I'm gonna have you bring your elbows together, and I'm just gonna have you roll out your arms like that for me. Keep those elbows nice and tight. Good. You can relax. Next I'm gonna have you reach up behind your back as far as you can with one hand there. Good. Let's do the other one now. Great. Next, I'm going to check some strength here. Elbows at your side. Don't let me push you. Actually, relax here for a second. There we go. Don't let me push you in. Good. Hands on your belly. Bring your elbows forward. Don't let me pull your hand off your belly. Good. Same thing on this side. Perfect. So I'm going to come over here now. Bring those thumbs down. Don't let me push you down. Good. Now thumbs up. Good. Any problem with that? No, okay. Can I have you hold your fingers out for me now? Do you feel me touching there on both sides? Feels the same? Okay. And there as well? Yeah. Okay. Perfect. Next, I'm gonna take this arm, I'm gonna bring it across. Any problem there? No. I'm gonna have you push your elbow into my hand here. Good. Next, you take this hand, put it on that shoulder. Don't let me push you down. Good. Just relax. I'll take all your weight now. Good. Good, I'm having you hold your arms straight for me, palm up, don't let me push you down. Good. Now I'm gonna try to give you a handshake. I'm gonna try to bring your palm to the floor, don't let me do that, okay? Fantastic, good. And what I'm gonna have you do here now, bring your arm across, thumb down, don't let me push you down. Good, now thumb up, don't let me push you. Good, all right, perfect. And that's it. Pretty quick as you see that is just in and out, but we said we went through everything. Inspection, palpation, range of motion, strength, neurovascular, special tests. Like I said, in and out, making sure we're not missing any big pathology, but it's as simple as that. You just watched a clip from my Master MSK course. If you want to learn more about that, click right here. And if you want more related sports and lifestyle medicine videos, click right here.